and welcome to The Big Picture. I'm Tina Jha. The centre has flagged concerns over increasing vaccine wastage in many states. At a review meeting to monitor the COVID-19 vaccination drive in states and union territories, the Union Health Ministry said on Tuesday that many states such as Jharkhand, Chhattisgarh, Tamil Nadu, Jammu and Kashmir and Madhya Pradesh are reporting much higher wastage than the national average, which is 6.3%. In Jharkhand, vaccine wastage is as high as 37.3%, while in Chhattisgarh, this number is 30.2%, meaning both these states are wasting 1 out of every 3 vaccine doses. In Tamil Nadu, the vaccine wastage percentage is 15.5%. In Jammu and Kashmir, it is 10.8%, while in Madhya Pradesh, this number stands at 10.7%, all above the national average. Now, this data comes at a time when the inoculation drive has slowed down or even halted in some parts of the country due to reported shortage of vaccines. So why are these states reporting such high wastage is the question. Is there vaccine hesitancy among the population there? Or are there other factors involved like whether the vaccines getting expired or plain lack of awareness? And how can this problem be addressed at the earliest? Because each wasted dose means a person being denied the vaccine, which is very, very precious given the crisis we are still dealing with. We'll explore all these aspects on this edition of The Big Picture today with 2 distinguished panelists. Let me introduce them to you. I'm joined on the program by Dr. Raman R. Gangakhetkar. He's member, National Task Force for COVID-19, and Dr. C.G. Pandit, National Chair of the ICMR. And Professor Y.K. Gupta, he's member, National Expert Group on Vaccine Administration for COVID-19. Thank you to both my guests for joining me on the program today. Professor Gupta, let me begin the program with you. All of us know a certain amount of vaccine wastage happens in all vaccination programs, and not just in India, this is worldwide. Especially if we talk about on a scale as large as ours, it is something which is extremely unavoidable. But if it is as high as 37%, how big a setback it is to the ongoing inoculation drive, especially at a time when we are still amidst this massive second wave of the crisis, and our priority is to ramp up vaccination.
Thank you, Rina. I think we must understand 2-3 things. Number one is wastage of vaccine in such a large program, in any vaccine, any country, is a phenomena which always happens because of so many reasons. 1, 2, 3, 4. I will just mention that if time permits. However, we do not expect the vaccine to be wasted more than 1%. I think that is the ideal situation. And if you just see today in India, the national average, which you rightly said, the vaccine wastage is much higher. 6.3% is very high.
Yes.
As compared to the acceptable less than 1%. And now, if you just see, in some places, in some states, it's as high as 37%, 30%, 15%, 10%. That means significant number of doses are going waste. Now, what can be the reason of that and how we can prevent it? Now, we must understand that each dose of a vaccine is precious. And at least at this time, when it is a precious, then ideally there should be 0 vaccine. And you very rightly said that a vaccine wastage means not only the precious thing is lost, but an opportunity of an individual to get vaccinated is lost. What can be the reason? Number one is a vaccine hesitancy is certainly a reason. Because we expect, suppose a center has indented 1,000 vaccines and it is only 600 or 700 turn up and there are 20 booths. Now each booth at the end of that is left 4 doses or 3 doses in each vials. So that remains a vaccine wastage. Now, so what can be done? So number one is increasing education so as to reduce the vaccine hesitancy. And that is important. Now, vaccine hesitancy in urban area, educated area, is much less, is reduced. However, in rural area, in uh, in tribal area, the vaccine hesitancy is still there.
Mhm.
So that is one important thing. The other thing is that we have to make more solid arrangement of indenting and then retaining it, and then having a program which is flexible. The Covin or whatever the app the different states are using, through this and through better coordination between the center or the procurement or the manufacturer who is sending it and the storage capacity at the places where it is to be done, I think is a much coordination which is required, and which is now being the emphasis of the central government and the vaccine providing mechanism, so as to have better coordination, better organization, education to the public, and also knitting more effectively the government sector, the private sector, and the centers which have less uh, equipped or infrastructure, healthcare infrastructure, because these are also the centers, so that there is adequate and trained manpower to give the vaccine, and also the proper storage process. And that is what is being uh, once again strengthened.
We have to all ensure that effective management is done so as to ensure reduction in wastage. So we'll explore how this can be done in the course of the program. But coming to you, Dr. Ganga Khedkar, we've spoken about how wastage is something that is obviously taken into consideration by the government while allotting vaccines to states as well. And this is unavoidable. I came across this term wastage multiplication factor, which is considered for vaccination programs. So help us and our viewers first understand the wastage multiplication factor that has been taken into consideration while planning the vaccination drive against coronavirus.
Like Dr. Y.K. Gupta talked about acceptable range of vaccine wastage, one needs to factor that part into whatever strategy you need to adopt at this juncture. I think what is equally important for us to understand is perhaps that if I was to look back as to what we could do in order to be very efficient in understanding how much of wastage could occur in different areas, like he pointed out that the healthcare infrastructure, wherever it is poor, presence of healthcare functionaries in different places, urban versus rural, perhaps those rates tend to vary depending on which location are we essentially talking of. If you actually look at the states where it is being reported, these are states where perhaps transportation, no, the time taken to reach to a vaccination site, no, those become important issue in addition to healthcare infrastructure issues. And also at the same time, it's an issue that is related to the health literacy. Health literacy essentially is going to be an important factor that influences vaccine hesitancy. If people are learning more by themselves, perhaps that's a reflection of health literacy. But if they don't, how do I communicate to people that you need to go ahead and take vaccines and why vaccines are very important? To me, this is a very serious issue. When we say 6.7% loss, you try to look at 20 crore dosages that have been administered so far, it would essentially come around close to 1.34 or 1.4 crore. Let's, for the calculation purposes, simplicity, let's say 1.4 crore dosages were wasted, which would essentially mean you could have had vaccinated, even 2-dose vaccination could have been completed in 70 lakh people. That's not a small number. If I assume that of these 70 lakh people, let's assume all of them got infection sometime or the belong to high risk category, they were The vaccines have been delivered to 45 plus population more and healthcare workers and frontline workers. Now, even if I take that there is 1% chance of death, you are looking at huge number of deaths that could have had averted had right kind of planning gone in. You could have had perhaps avoided 70,000 deaths that could happen. Some seriousness has to come in. I think all state governments have to reflect upon their own strategies, why this vaccine shortages are occurring, take steps to correct them. Please retrain your people, try to ensure that there is effective communication that goes in the community, and also ensure there is a balanced mix of registered cases versus those which are not registered, so that if there is a likelihood that some people don't turn up, you should be able to ensure that the dose will not be lost, but you will ensure that some people can actually fit in and still receive it, though they were not registered at this juncture. I think it's a reflection of perhaps something which is completely preventable. If it can be preventable, I think we should take adequate steps and ensure that this doesn't repeat over a period of time. It goes on reducing to a larger extent, and this becomes very important at the backdrop that you have the shortages of vaccine across the world. This
Absolutely.
you cannot equate this with the universal immunization program, where perhaps shortages was not a big issue. So if we accepted even 1% as a rate, I think the closer we go to complete usages, that would be extremely essential. I also understand that it is possible that the wastage is high because these are multi-dose vials that people are receiving. But to make it into single user kind of this thing would perhaps reduce the number of dosages that you can generate. And that perhaps is also an important issue, along with the disposal that you will have to do of all these vials. So given all these facts, I think you will have to ensure that their corrective measures are taking place, not only at the state level, at health system level, but also at the community level as early as possible, so that we can bring down the vaccine wastages.
Certainly. And with vaccines in short supply, very rightly pointed out there by Dr. Ganga Khedkar, more and more effort must go into curtailing wastage. And that is the need of the hour, because the number is very, very worrisome when we are in a situation when we have been hit by this massive second wave. Professor Gupta, among the states that we are talking about, which are reporting high vaccine wastage, are Jharkhand and Chhattisgarh, the two states with significant tribal population. So obviously, vaccine hesitancy looks like one of the prime factors behind this low inoculation and high wastage. But and also the other factor could be transportation that Dr. Ganga Khedkar pointed out into some of these areas in these states. But what about states like Tamil Nadu, Madhya Pradesh? What could be the potential factors behind these states actually reporting more wastage, which is obviously much higher than the national average?
See, if you just see the wastage in Tamil Nadu, this is around stated to be about 15%. In Madhya Pradesh is about 10%, which is still high. Is not within the range which is considered to be acceptable. 1% is definitely high. So we have to do the root cause analysis of that. So there can be multiple factor, and one factor is that when you do online, one of the factors, multiple factors, of course, vaccine hesitancy. I still believe there are some pockets where the vaccine hesitancy is still very high. Misbelief, lack of education, and these are the things which need to be, whether it is even urban sector, people have that you will become important and you will become this and that. These are the, in some pockets, these are there. Sometimes what happens, because of the online registration process, there are 20 people have registered and only 15 had turned up. And because out of these 15, maybe 4 have been misled on the way. Are yaar, kahan ja rahe ho? There is no need to have, and let us wait for some time. It is this. There is somebody who has got vaccinated and got this problem. So now, some people did not turn up because of the obvious reason. Some because of the misled by the people. Anyway, the people who have turned up are much lesser than those who have registered. So what is ultimately going to be the wastage at the site? At the end of the day, there are lots of vials which are left, one tab, one dose, two dose. So possible solution, learning from the past, is that also do parallel on-site registration. That could be one solution. How it will work, it is yet to be examined and permitted. So on-site registration means you permit those who have come on-site, just have that, and so that this wastage can be prevented. We cannot also do that. You do overbooking like we do in flights, and then because then there will be crowd, and then there will be crowd, and then people will be offloaded. So that is also not done. The second thing is better management. Suppose you have registered 200 or maybe 300 for a day, and everybody turns up in the morning, and then half of them they're fed up and then they go because of the weather or whatever it is. Instead of that, can we put them in a staggering manner, that 1 to 2, 2 to 3, 2 to 5, maybe like that. So that is also a method by which this type of wastage can be reduced. This is more important when there is a highly populated and more rush, and also the large number of centers to be increased so that people go and have a comfortable vaccination, and then they do it. So these are the multi-pronged approach which is being now attempted so as to improve this.
Okay. Dr. Ganga Khedkar, the challenges that we are facing now with our COVID vaccination program, I'm sure some of these challenges must have prevailed even during our previous immunization programs. How did we meet these challenges then? Because we have had a history of carrying out successful immunization programs like the Pulse Polio program and several others. So how did we deal with these challenges that we are now facing in terms of lack of awareness, in terms of misinformation that is percolated from one section of the society to the other, in terms of a lot of hesitancy that is being reported from different pockets?
No, that's a very good question. If you actually look at it, vaccine hesitancy is not a new thing to happen. Most often you will find that any vaccine that you launch, for that matter, anything that we do, there will be at least 50% people who would say, why should I do it? That's very common human response. But when we look at other vaccines and think about COVID, there are major differences. For other vaccines, these were vaccines which were time tested. We knew more about it. We understood what are the adverse events, and is that vaccine likely to kill an individual or lead to a very severe outcome if I administer that at home. You find majority of these large community-based campaigns, especially for polio, actually almost went right up to doorsteps of that individual. But that luxury doesn't exist for COVID vaccines at this point in time. The second issue, which is also important, if I want to tackle, how would I do that? Perhaps I could go closer to certain apartment complexes, and there I could think in terms of administering in a rented place or in a place which has been provided by the society, which is approved currently by the government. So it's time that the local administration utilizes this approach as aggressively to try and ensure that the vaccine wastage comes down. The second issue is, for other diseases, we knew that if there is a vaccine hesitancy that was there, what we used to do was go for community mobilization. Do you have enough of time now? Now, given the fact that every time we have seen between first and second dose, you had only about 3 months time to ask the people that they could go ahead and take the vaccine. Now, that 3 months was the longest that we could actually have got. Now you would have second wave. To my mind, between second and third wave, you would have more than that. perhaps close to about 6 months' time, unless a new variant comes and challenges the entire hypothesis strongly. Within that 6 months, you will have to mobilize the community in such a manner that the demand tends to go up. Now, everything that happens, no, depends on the community which is going to receive the vaccine. If the community does not accept the vaccine, you need to find out the reasons why they have doubts about this vaccine, or why are they not accepting. I think if there are general structural issues, like people are unable to come to the hospital, or the hospital is far away, then you can move towards them. But if there are structural issues, like, some people came up with the kind of WhatsApp messages that it contains pork, and therefore one of the communities said that we won't take these vaccines. I think those each individual issues have to be handled appropriately. What is equally important for us is, though we have not spent sufficient time into issues of decentralized implementation science research done at a peripheral level and people taking decision all by themselves, we have come pretty close, when it comes to National Health Mission, where one of the angles is doing implementation science research right there and altering your strategies. I think it is time that people understand what is rapid appraisal that you can do. Now, when you do rapid appraisal, you need to do a diagnostic work in implementation science, and then actually take to the people, understanding why a particular issue is happening, and ensure that there is a high acceptance. I think what is important is, it's not only people who need to understand importance of each wasted vaccine dose, it's also equally important that every healthcare worker must understand. No, if both understand that part really well, things can be dramatically different. You find that there is a huge vaccine eagerness when it comes to, younger generation. Once you opened up below 45 years of age group, their numbers have gone up like crazy in the COVID app. But when it comes to older population, that's not happening. When it comes to rural area, that's not happening. Why does this happen? It's because the community doesn't understand what it is expected to do. I would rather worry about involving both. You should allow a decentralized approach to take place. A centralized approach will be detrimental in terms of people waiting for guidelines to be issued. They have been empowered so far to decide by themselves on every strategy at district level. Now, if that is so, I think they should think in terms of saving these vaccine dosages by ensuring that they have looked at why this is not happening and adequate steps being taken. They should not wait that somebody should come and tell them how to ensure that the vaccine wastages are lower.
Absolutely. Professor Gupta, so do you think, taking on from what Dr. Ganga Khetkar is suggesting, that the states now must retrain and reorient vaccinators in this age of social media that Dr. Ganga Khetkar talks about, where information is flying thick and fast, people tend to believe each and every word, and also we are in a crisis where we are running against time. The biggest challenge is to ensure the judicious usage of the precious vaccines that we have?
I would say, to minimize the vaccine wastage to acceptable less than 1%, a multiple organization, multi-pronged approach is must. And Dr. Ganga Khetkar very rightly said that you have to basically percolate the all educational system, administrative system, the logistic system right to the bottom. And that is where, starting from the alleviation of vaccine hesitancy, not only in the Delhi, Bombay metro cities, but also to the level of poor people in villages, or maybe in peri-urban area, or maybe in tribal area. That is important. And for that, the state government will have to play an important role. because percolating to that level using different type of media, different type of communication system can happen only then. And also it is important to use the what is called as an adaptable the program system. Maybe you are now more flexible, complementable. The CoWIN app where it can register online also in government's things, publishing the schedule by the private organization that this is day one, this is the timing which is available for that, rather than making it one crowd, and also making effective transportation and then making an officer responsible for at what time the delivery reaches there and at what time is the whether there is a appropriate storage condition or not, and whether there is appropriate people to administer that. So all these things, basically operational thing, will be done by the state government, and state government to the district collector to the COVID vaccine center, CVC. Now, this requires much stronger, effective coordination mechanism. So, center, state government, maybe European NGOs also, and private sectors, and public understanding. Everybody will have to understand that each dose of vaccine is important, not because we have a limited number, but also because this, as very nicely mentioned by Dr. Ganga Ketkar, this will devoid any person of getting it, and he has calculated how many lives could be saved if this vaccine wastage could have been effectively utilized.
Certainly. So, two very crucial suggestions made by both our panelists, that a decentralized approach is the need of the hour. The states will have to retrain and reorient themselves, their strategy as far as ensuring judicious use of the existing vaccine pool is concerned. But Dr. Ganga Khedkar, if we talk about the demand supply of vaccines, certainly looking at our population, we need to, enhance the production and also procure it from other countries who have been producing these vaccines. So to that regard, we've seen in the past few days, some states have reached out to global manufacturers, but what their version is that companies like Pfizer, Moderna have refused to supply to them, saying they will deal with the central government. So one question that comes to mind is, can companies like Pfizer, Moderna, or these manufacturers who have not, ensured that they go through a local trial in the country, or they have not sought approval from the DCGI, can their vaccines be used on our population?
Yeah, actually, that part doesn't, it ceases to exist, because when Government of India changed the strategy, it was already spelled out a few weeks earlier. No, especially when if I recall correctly, when the age of vaccination was also brought down to 18 years, that people can, those vaccines which are approved by certain regulators, they don't need to do anything. Their vaccines can be marketed in India. Okay. But one needs to accept. No, see, there is one thing which I fail to understand. No, it is good to have expectations, but expectations have to be realistic. No, if you don't have realistic expectations, there will be failures that will come. All of us, we want vaccines. No, we know that vaccines perhaps are crucial for us to ensure the mortality rates would come down. The infections may indirectly come down over a period of time. But what is most important is we don't recognize that vaccine dosages are not available. And it's not only local phenomena, it's a global phenomena that exists. And therefore, if we think that Pfizer and Moderna is going to give me a large amount of vaccines, perhaps I am not realistic. No, their dosages have already been booked. Their deliveries are fixed for a long period of time. And therefore, people should not expect that you will get somehow no some vaccine dosages from outside which where the manufacturer is also not willing to provide at this juncture. What would be prudent for us? No, the prudent thing for us would be use those vaccine dosages that have been given to you without wasting them as much as possible. Try to ensure that we do what we can more effectively first, and then whenever those dosages come, we will still be better placed, because in any case we are not getting them as of now.
So with that, I have to call it a wrap of this edition of The Big Picture. Thank you once again to both my guests for joining me on the program today and sharing your thoughts with us on this very, very important subject on how to ensure or reduce vaccine wastage at a time when it is so precious for all of us. So thank you very much once again for joining us on the program, Dr. Ramanganga Khetkar and Professor Gupta, and sharing your inputs with us and our viewers. To my viewers, take care of yourselves. We are still going through this pandemic. So ensure that you maintain COVID appropriate behavior. Take care of yourselves and your families, and see you again same time tomorrow. Thank you very much for your time.